Everyone can hear okay? Fine. Yep, fine. So the company's internal healing and wellness. And we're trying, basically what is functional medicine? When people hear that, they all kind of know they want this, but they're not exactly sure what it is. So we're very interested in the root cause of illness and disease. The traditional medical model will start with giving you a label saying, okay, you got this stamp. This is what's your diagnosis, this is your condition. And then you move forward with what the standard protocols are for treatment, whether it's medication, other imaging, therapeutics, consultants, etc. The question seldom happens as to how did we get here? So the root cause part goes, what's upstream from the point at which you got the diagnosis? And then that's where we like to take advantage of every tool available in the entire spectrum of disease. So that question then leads to the next point of what are your determinants of health and wellness? Like what factors are at play in your body to make you at your optimum state of health? Or what's getting in the way for you not being the best version of you? Could it be variations of things, of pollutants, toxins, heavy metals, nutritional deficiencies, which are a lot more common than we think, and they're seldom measured for. And also emotional, mental, spiritual, unmet needs. At the core of the matrix, which I'm going to show you next, is what is the framework that a functional medicine physician or provider is trained to look at you. So when you enter the room, it's not just a bunch of problem lists like labels, stamps on you. It's looking at you kind of in the holistic mindset of putting in discrete pieces of information together to generate that kind of picture of you. And it's particularly for us what we need to work on next to get you to the next better version of you. So let me show you next what the kind of framework is. Okay, this is kind of what I was saying more about. Let me just talk about the visit, what it looks like. So what you'll notice in a functional medicine visit is there's a lot more attention and time on talking. There's a dialogue, there's a conversation. It's not just I'm looking at my watch rushing to get into the next room and out. And that mainly exists because of insurance requirements that the only way to really keep a clinic open is you've got to keep moving because you're not getting reimbursed. So that takes care of that part, is you're getting focus and time that you deserve to need to figure out what is the root cause of your problem. So there's time. Putting the puzzle together, that part's often missing. What you're typically going to see is whatever specialist that you're seeing is going to focus in their box and fix this box problem, and once we're done with this box, it doesn't matter, it's gone. It could be a big problem over here, but I'm responsible for this box. Thank you very much. And that's it. And people are very frustrated with, well, who's going to put this together? And just give me an overview picture of, can you help me just get to a place of wellness? Like, I'm stuck. And it's not just, okay, the cardiologist will say this, or the endocrinologist will say that, but no one's really talking together, no one's looking at all of you. And that's a key component of what functional medicine is. Some of the tools we use is the whole term of being the best version of you is what's going on in your body and your genetics that's getting you in the way of expressing that. It could be something simple as, are you eating the wrong thing for you? Are you not having enough of something that you are requiring, like nutritional supplementation? And a lot of these concepts that you'll see in the supplement world, nutrition, that's like the foundation of medical school. The first 2 years of medical school are completely involved in how the body's supposed to work, biochemical, physiological, like what's the normal version of you, and then we learn the abnormalities, the pathologies, and then all the focus is on what we do, the medications, the surgeries, that the tools are kind of the fun toolkits, they focus on that and that's it. But we often forget, what was the first two years of medical school all about? So in functional medicine, we don't forget that. We try to optimize existing pathways to be what was already there. There's a lot of wisdom in our design. I mean, to study the body was a daunting task, and it's humbling. And there's already a lot of kind of internal wisdom in us to want us to get to the point of optimal health. But the question becomes, what's the roadblocks in the way? It's a complicated system, and it requires a little bit more of a broader approach. All right, so I want you to remember the best version of you. So this is kind of what I was talking about when I say looking at a patient, and I'm going to, instead of focusing on, let's say I'm a heart doctor, I'm just looking at your heart. That's just your heart. There's all of you, but I'm just looking at your heart. In the functional medicine mindset this is kind of the overall broad view of how we look at a human being. So starting on this side over here, this is the antecedents, triggering events, and mediators and perpetuators. So this is a lot of emphasis on the point of the problem is here, and traditional medicine goes this way. That part of the matrix there looks at what's on this end. What happened neonatal, perinatal, what happened early on. Were you a kid growing up on a farm and crop dusters or whatever, it was fun, you used to have a good time about it. What happened way back when, times that you may have forgotten about. So that's this section here, and that's a good chunk of time is there. On our intake, we assess that a lot. On the bottom here, each of these areas you could spend a career on. Sleep and relaxation, exercise and movement, which in typical Western society we really don't do enough of. Nutrition, and in, I mean, by itself it's a whole universe, but the honest truth is in medicine we really don't spend much time on nutritional training. Maybe it's 8 to 10 hours. Very little time is spent on what we need to eat, how do we feed our body. And what that translates to when you're speaking with your doctor is, if you're starting to talk about nutritional questions, needs, they're going to gloss over because they just don't have that much detail. There is a lot to learn, and it could literally be its own career. And they don't have that. That's not their tool set. So I have to be honest about the limitations of what's taught, but it also has to explain why nutrition is not really emphasized. And one of the things that used to get me when I was a hospitalist was, what do we feed patients? Like I used to walk in the room and always look at the tray to see what they ate. And it just doesn't make sense what we put in people's bodies when they're at their sickest. Stress. That could be a career by itself. Stress management, stress mitigation. There's very little training on what to do for people who are saying, everyone says I'm stressed out. Life is stressful. But what do we do about it? Some people intuitively find, okay, there's mindfulness-based practices and things that kind of therapeutically release things or process information or energies. But in the traditional medical model, they'll just say stress and we stop there and that's it. They don't really think much beyond that. Again, there's a whole universe in stress and how to manage it. Core function, relationships. How often are you asked about what's going around in your life? I mean, again, we're focusing on the heart, but what about, toxic neighbor, parent, family member, boss, friend, something? What about the relationships around you and how those affect your health? Is that often even asked about? Or if that's an elephant in the room but that no one's willing to talk about, somebody needs to break the ice and say, what's going on here? So then this ties in on the outside, kind of like things around us, and then it's the core. If you notice the core of the functional medicine matrix, we're not looking at, say, DNA and structural anatomical things. Those are actually peripheral systems around here. So those are all the main systems of the body, like the immune system, the cardiovascular system, the GI tract. These are all core foundation, and we have interesting tests for all of these. But the core of the matrix is we care about your mental, emotional, spiritual state. Because if you don't fix that part in your life, nothing else is going to fix. Further out, you look at fancy medications, CT scans, the latest medical therapy and wizardry. Nothing's going to make it better when you have core emotional defects or spiritual defects, moral injuries. These things have to be addressed. When I first started looking about this, and actually I'm going to borrow these 2 books, I started kind of reading these in my own journey, and these are fantastic. I love these books. I use these a lot. I mean, there's similar other books, but this one's a phenomenal one on trauma, and I almost always screen people for traumas, and I'll get to the reason why. And so it helps with issues of like emotional neglect and codependency. But the reason why I like to screen these issues, because these go to the heart of the matrix, and they're so often neglected. When I read the books, they said, oh, this is a very common issue in society. Yeah, this can't be true. We don't talk about this. If we don't look about it, it doesn't exist. We don't talk about this in the hospital. You don't talk about this in ER or TCP. Just often not brought up. But when you start screening for it, you will be surprised, 1, that it's there. 2, how prevalent it is. 20–30% of people have bad things in their closet. It's not their fault, but they're still carrying them with them. And it's constantly weighing in the back of their mind, whether it's emotional stress, affect your cortisol level, affect your adrenal act. It starts entering into the real world quickly, but it comes from a place that we can't measure, and no one really asks about it. And this is wrong. It needs to be asked about, at least in my view. I feel that if you start from the center out, things fall into place much, much faster. So it's something that was not emphasized, unfortunately, in the medical model. And one of the limitations is we do in traditional medicine, my day job is a primary care physician, we do in traditional medicine what's billed for, what's coded, what's in, what you can put in an Excel sheet. It sounds kind of sad, but it's true. So there's an ICD-10 code, an associated billing code, it's all codes on the back end. And you really can't code or get paid for anything that doesn't have a code. If it doesn't have a code, and a lot of these things here really are not really emphasized because there's no money in it for medicine. Things that take time are typically not emphasized, and that's where these things often get neglected. It's not so much done on purpose, it's done behind the scenes as how do you categorize it, how do you capture it, and how do you get reimbursed for it. And if that doesn't exist, guess what? We don't ask. Alright, so that's kind of the matrix here, and I just wanted to highlight the big picture is you're not just one box when you see a functional medicine doctor. You're a human being with multiple complex, like a moving ecosystem. So another way of kind of putting that in is, say, if we look at the example of the medical problem, obesity, and that has like an ICD code, like what there's an ICD code for obesity. The traditional doctor will say, okay, obesity, maybe it'll talk about try eating a little bit less, maybe nutritionist, and then gastric bypass. Maybe there's some medications on the work here, but not much. In the functional medicine way, you say, what are the root causes of obesity? Are you having that, what do you call the belly fat muffin top because you're chronically inflamed? Maybe you're eating something wrong. Are the hormones disbalanced and fats now moving in different locations of your body and you don't know why? Is there a genetic phenomenon happening? Is something happening at the level above the genetics called epigenetics? So the kind of that interface with the environment and your genes really kind of come together. Diet and exercise, there's emphasis on that. Mood disorders, going back to the center of the matrix, like emotional issues. Why is that obesity existing? So one disease could have multiple causes. Similarly, in an opposite way of looking at it, one root, like a core function that's abnormal, like inflammation, can manifest in different people with different diseases. So maybe someone's genetics say, hey, they develop more heart disease. Maybe they have more neuroinflammation. Where is the inflammation? Up here. And they're manifesting in worsening depression or anxiety. That inflammation, everyone knows about arthritis, chronic inflammation over a lifetime. You might have, manifestations such as cancer. And then inflammation also manifesting in diabetes. These are all evidence-based. There's plenty of work in the literature, but again, the emphasis isn't really there. What's putting this all together? So, if you see a functional medicine doctor, the intake process involves a lot of questionnaires. We look at, the health questionnaires, and there's pretty detailed timelines, and we try to put things all together in that sense. Emotional abuse, we talked about the books, things at the center of the matrix. Traumas, codependency, again, very common issues in society, but not talked about. Maybe it's a taboo subject, people aren't comfortable saying it, but there needs to be a place for that to be an outlet, to be discussed, to be kind of therapeutic. You need to have the initiation of the therapeutic process. Then other things we'll do is laboratory assessments. So typical labs, like Quest, things you would get at LabCorp, Quest, we would look at typical blood work. And then there's advanced labs where we look at those core functions in that functional medicine matrix. So things like advanced stool, like microbiome test, advanced hormone testing, micronutrient panels, toxic burdens, immune signaling like inflammation pathways, food sensitivities, detoxification. These are basically the core functions of being the best version of you, those core physiologics, subsystems that need to be working right. And how we navigate to this is we do the intake paperwork and we see where's the most heat on that map I showed you, that matrix. Sometimes you'll see it's a certain section that's just lighting up and other sections are fine, there's not much signal over there. So we begin to focus, hey, what's going on in this? And you look like someone that's inflamed but doesn't look inflamed, but everything else about you is screaming, I'm inflamed. So maybe we're going to look into more detailed testing of inflammation. There is a logic to the madness as far as ordering the test. Now you could dive in and order everything, but it would be burdensome as far as cost. All right. So these are the websites, both domain names. So I'm trying to use. Not everyone kind of knows IHLMD, so that's going to be the main, but both work. And I want to thank my web person who's right over there, John. He's also the magic behind. I'll mention this later, but creating a business is not as I don't have an entrepreneur hat. I'm a physician, and that's it. I don't make businesses. I don't know balance sheets. It's not my language. But also the web world, now I'm about 41 almost. 20 years ago when I was a youngin', I understood, you could Photoshop this and internet that, and ICQ or whatever. And then I look down, do study, come back, a couple of gray hairs in my beard, and the whole world has changed. I try to look at this I don't know. The first time you call me, okay, we're going to talk over your SEO. What's an SEO? So I didn't understand that world, and I'm grateful that I have you, John, so thank you. And he's the one that's going to help interface you digitally through modern standards. So everyone needs one of those SEO officers and web designers. I am grateful for that. Thank you. Sorry. Why can't I get my mouse? Huh? There you go. All right, sorry. All right, so let's talk a little bit about how I came from the traditional allopathic model to functional medicine. So med school finished for me, graduated in 2008, residency was from 2008 to 2011. That was in Cleveland, Ohio. So that's a traditional internal medicine, adult internal medicine, MD training, grueling hours, very typical stuff. Then I, obviously being in Cleveland, Ohio, I was attracted to, hey, let me work with the biggest fish on the block here, is Cleveland Clinic. So I was something called a staff hospitalist, so if someone came to the hospital and you had a pneumonia or grandma had something, cellulitis, UTI, you'd be admitted and then eventually get to a medicine ward, and that was my job. I'd take care of you when you're in the hospital, kind of coordinate everything and get you on your way hopefully better than you came in. So I was there till 2015. I was waiting for my wife to finish her training in Chicago, and we decided to kind of make a new leap. But she didn't want to come to Ohio, and I didn't want to go to Illinois, which I'm very grateful we did that. So then I started Googling things, and I'm like, hey, where's a good place for young docs? And they said, Texas #1. So I pitched Texas, and she was like, Texas? what about California? I'm like, I can't afford California. I got student loans. All right. What about New York? Same problem. So then that kind of went along, and eventually kind of had to she begrudgingly came. And then 6 months later, she's like, I love this place. So, thank you, Texas. First job was in the med center at CHI St. Luke's, named hospitalist. Kind of crazy down there. Transitioned then to Memorial City, Mem City, and that's where I had an interesting conversation. I was doing hospitalist work. I've been doing it many years now. And I get a call from an administration called a component called utilization review, which is a nice way of saying, they're like the managers behind you that say if something's not, patients are moving fast, you get a phone call. So I got a phone call saying, why is this patient so here? I'm like, well, do you have abdominal pain? I'm waiting on an abdominal film x-ray I ordered, because see what's going on. It could be a bowel obstruction, I'm not sure. So why aren't they discharged? I'm like, I literally just ordered the x-ray and I'm waiting on the results. The radiologist hasn't read it. Why did you delay care? And then in that moment, like a twig snapped, and I started just screaming at the guy. I said, listen, it's kind of offensive. You don't ask me why I'm delaying care. Like, I'm not trying to cause this problem. And you're clearly interrupting my patient, doctor-patient relationship. So I, established that boundary firmly, but I thought about that and I realized something's not right. That was kind of my, wake-up moment of something's not right in healthcare. Like, who is this person? Not even seeing the patient, nothing to do with the day-to-day happenings of the patient, telling me what to do. And I was like, no, something's not right. It's getting worse. The kind of the administration and the corporatization of healthcare is getting stronger and stronger. And basically, the physician just became like a cog in the wheel. And I wasn't okay with that. So I said, what are my options? And I started thinking, okay, well, maybe it's time to think about patients in terms of network and forming a more established relationship rather than just kind of the one-touch pass. I see you for 4 or 5 days, you discharge, and I may or may not see you again. So I transitioned to become a primary care physician. Also with moving into the Woodlands, by which it was my wife that decided for us to come here, because she came here once and fell in love with the place, so we're in the Woodlands. So became a primary care physician at Genesis Medical Group. And then that's where apparently, I guess, some of my first contacts with some of the members of the Crunchy group. I didn't know. I started having some patients that were just, and then they were happy and we're talking about things. And I guess I was a very crunchy doc without even knowing I was a crunchy doc. So I was in that journey, doing traditional medicine, outpatient style. And then I got interested in the Institute of Functional Medicine, which is the body that I chose to certify with. There's a few different integrated medicine. But I needed a place to kind of give me the skill set that I didn't have from medical training, medical school, residency, and that's what IFM. And there's many aspects of IFM. You could do the nutritional thing. There's a lot of things you can do. So it's like its whole own ecosystem. So I started getting that. I did my certification. I got the IFM degree. And then I said, well, how do I practice this? And I was having trouble implementing this in an insurance-based model, because that's where the lack of my kind of business skills came into. When I tried to implement a business plan, how do I do this? And how do I do it in an insurance model? And I just roadblock after roadblock after roadblock. And then finally I was like, I think I'm going to have to go outside of the model, and because I can't get this. In order to get a test approved, you had to like beg, and the paperwork, it just wouldn't work. You'd be death by bureaucracy. So the only way to do it is in the cash model, which is why many functional medicine docs are in the cash space, because insurance just doesn't want to deal with it. And if they do, it's very, very, very difficult. That's not to say that other programs could be helpful, like HSA, and I'll show that later. But so that I created the website and decided, now what's the future vision? So that brings us to the future vision. Especially after everything that happened with kind of the last 2 years, COVID. Something's happened in healthcare, and it's not good. It's getting worse. There's kind of people dictating what you can and can't do, what you're allowed to do with yourself. As far as procedures you would put in for yourself. You're being kind of coerced. You're being restricted from treatments that I think work beautifully, but now there's kind of this weird fog of war out there, and there's fundamentally, it boils down to the healthcare system is sick. The existing system has a problem, and I don't know if we can fix it from within a sick system. I think it's much sicker than we think it is, and things will start changing quickly. The last 2 years has been kind of an eye-opener for many people, many physicians. Not all of them can speak out, and many patients are realizing something's not wrong. I'm getting a lot of my patients, my day job, are saying, I don't want to go to the hospital. I'm scared. I don't want to go. I've never heard that before in my entire career. So I think the direction is, what do we do if we're stuck with a system that's not working well? If we can't really change it from within the system, what's the solution? So we have to create our own networks. And it's going to exist on the healthcare system, kind of the wellness system, something away from the standard insurance model. You have to remember that healthcare is about 1/6 of our GDP. I mean, it's a huge chunk of our expenditure. It's big money. So we need to kind of create our own networks, support each other, find each other. And I mentioned here that I think the insurance, yes, there is a part of the problem with the insurance system. Now, currently you'd have to have some type of insurance for, let's say, something complicated, like what my wife does, she does oncology. I don't see that happening in the cash-based model. I just don't know. I don't know how it would happen until chemotherapeutics are way cheaper. So there's a role for insurance, yes, I admit that. But for a majority of our interactions, many of them are in an outpatient primary care type of setting. That's where the majority of your lifespan is what you'll be doing, is talking to your PCP or something in a primary care level. There has to be a better solution for that outside of the insurance model. The cash-based system offers that because we're no longer dependent on the insurance system. There's going to be price transparency, which good luck finding out the price of anything in hospitals. And utilization of high deductible plans, vis-a-vis HSA, FSA, I think is going to be the direction of the future. The bottom line is trust has to be reestablished, and there are certain litmus tests that patients are looking for. And how do I know I can trust you? And that question's up. I don't know if I can trust you anymore. So maybe they're more open-minded to other therapeutics for, say, COVID, for example, or whatnot, but eventually people are going to have to find a way of resetting the system now that there's been a major kind of core disruption. It's one of those relationships in society that's not supposed to be disrupted. The teacher-student relationship is sacred. The doctor-patient, it's a sacred relationship. When there's corruption in something sacred, there's a problem. We could fester about it, or we could be kind of proactive, and I think that's going to have to be part of the discussion, throughout. But what can we do here locally, in part? So yes, in functional medicine, it's a very detailed one-to-one ratio, usually the doctor-patient, but that will come at a higher cost. It's something I don't have a problem with this. I can't control that because there's a certain set point you have to stay open. But not everyone can handle the cost. So one of the solutions will be considering group classes. So let's say you can't, the introductory cost is too much. What can I do to say, I really want the functional medicine approach, but how do I approach this from a more cost-effective point of view? I think one of the plans I'm thinking about is if we're grouping, for example, a metabolic day, so diabetes, maybe hypertension, cholesterol, put that together, make a class, and then everyone's there kind of in a similar theme, so I can kind of get the same type of message across. It may be a little bit briefer as far as the labs and individualization of the lab reports interpretation goes, but the class could be one session. So we could talk about, say, diabetes. We could talk about hypercholesterol, some type of medical problem that's grouped. The trade-off is, people come in a group class, obviously, it's not a one-to-one thing, but it's a group. So that's an option that kind of create a solution for everyone. The vision is I'm wanting to recruit like-minded pediatricians, adult doctors, whether PAs, NPs, nurse practitioners, to kind of grow this and create the primary care angle through DPCs, not insurance, and then the functional medicine attaché, which is kind of a specialty of the clinic. I think what the direction going forward is in fact, I'll tell her there's one, maybe she might have been a crunchy mom, that said that if you give me a couple of pediatricians who are not going to twist our arms about, let's say, a vaccine schedule, or not judge us, or not trying to kick us out because our kids aren't following exactly whatever their mandates are, you'll be full in a month. That's what do you mean? So there's groups of 1,000, 2,000 moms that are all having a very similar sentiment. So one of the advantages of being connected to the Institute of Functional Medicine is I'm going to be keeping an eye out for people, let's say you have a pediatrician who's IFM certified. Hello, Woodlands is a wonderful place. Welcome. So that's kind of the vision for the future. The other thing is, once you kind of create the core medical services, is if you remember in the matrix, there's all those things around the matrix, like stress and nutrition. So all of those will have people you need to talk to. If I have a nutritional issue, I have an eating disorder, maybe I'm feeling spiritually I need something, I'm looking for some energy balancing, whatever it is, those type of attachés, and there could be many of them depending on the community needs. I'm interested in trauma, obviously I like the books. Nutritionist, it's something I can't do by myself. There's a lot more to nutrition than any one person could really master. Physical therapy, I'm into movement and massage, particularly myofascial work. I think it's a phenomenal area that's neglected. Myofascial conditioning, which would be the next level once you're kind of myofascially open, is how do you strengthen that? And what are the movements you need to kind of keep the movements of life in good order? So these type of different attachés I'll be looking for. I'll be kind of relying on the community to say, hey, I'm here, I have this skill set, can we synergize? I think what needs to happen is stop looking for other people to give us solutions and find the community is blessed. The community has talent. Each one of you has something you're fantastic at. It's time that we just kind of start synergizing, putting it together. And I think it's going to work out well. And let's see what else. So, yeah, my promise was I'm not going to compromise on serving communities' medical needs. I'm not going to sell out, start saying you can't do this, and it's not my style. I'm trying to be the doctor I always was, which was, everyone saying, oh, you're doing all this amazing stuff, and it was always me. would have been that guy 10 years ago. I just don't know what happened in the grand scheme of things. Half of my colleagues, what are you guys doing? I don't get it. I don't get what the hospitals are doing. I don't know. But my promise is, I want to make that promise to you, not compromise on delivering good medical quality. Morally, answering to higher power. At the end of the day, I have to sleep at night. I have to answer, what did I do with my life? What did I do with the ability that I was given? Can I go to sleep saying, my conscience is clear? I think that's a very important part for me. Is if I'm not having that situation with certain my colleagues, my buddies from med school, I'm the weird guy now. Okay, I'm weird now, but you know what? This is the hill that I'm going to make a stand on. It is what it is. And I never want to betray trust. I think it's a very important thing. Again, the physician is a sacred relationship, as many other core kind of things are in society, and you really can't betray that trust, because once that's gone, it's going to be hard to bring it back. And I don't know how that's going to happen in kind of the standard healthcare model. There's about half the people that are very, very distrusting of what's going on out there. It's going to be a problem. We need to make the solution. I want to also think part of the solution also was evolution out of a conversation. Where did John go? But we saw John. He's also the web guy, and one of the problems we're having is certain words you can't mention online. There's you go to the Facebook jail, or you have to use codes, and what is this? We can't even have free speech. We can't freely communicate in groups, and everyone has to speak in smoke signals. So the problem is also now, if social media has problems. One of the things I pitched was a little bit broader, but John brought the focus in and say, well, how do we get people? Let's say in this room there's a yoga person, a Reiki person, whatever elements in the wellness space. How do we talk to each other in a way that's we're not going to get censored or thrown in Facebook jail or whatever jail? How do you ensure free communication, especially in our healthcare needs? It's your business what you want to do with your body. As long as it's not hurting yourself, hurting others, it's not my business what you do. You have autonomy. We have to respect that. But if you're not even able to talk about things or collect or organize, or let's say, hey, in the previous slide, I opened a functional medicine clinic, and someone over there has lymphatic, let's say, expertise. Maybe they want to be able to connect with me, or I want to be able to connect with them. Something like LinkedIn, but a little bit more of a clear platform where it's about serving the community and bringing people of a similar mindset together, synergize. So this will be, I think, just to kind of do a plug, justholistics.com is going to be that platform. So I think there's the website there you can just keep in mind, look into that. It's going to be kind of a space to connect, and the point of it is it's its own social media platform that should not be disrupted by any kind of censorship. That's coming, there's a vision behind that. I'm hoping it expands to basically a much broader platform, because what you're going to have to do is if you're going to go independent, let's say in making your own healthcare networks, you're going to have to do the same thing with social media. You're going to have to stay away from where the cash flows are, like the insurance and all that. Everything, you're going to have to basically rip the scab off. So social media is going to be part of it. All right, that's on there. And I want to share this little a little bit here, so I'll just finish up with. You know, about let's say 2 years ago when I was doing all this, planning to do the course. Okay, now I finished the course, I'm certified. Okay, now go create a business. What? Like, I have a full-time job, I got little kids, I got both my kids are in diapers. What am I supposed to do? So I used to spend a lot of time in the house we were before, the study was upstairs. Now we sit in there planning, what do I do? I need to do this. And my wife said, what are you doing up there? Like, you're spending an awful lot of time in your study, you're not doing anything, you're just thinking. Because a lot of it was this. And I had no idea, and I was overwhelmed. I'm like, what's a payment processor? What's a website? What's SEO? All these things. What is this? I don't know what's going on. It's not my skill set. And then I had this kind of a little bit of angst, a little bit of panic, and I had this thing just to write. And I wrote that. I wrote the time and the date. So there it is, 12/16, 2020, 3/16. And I said, with time, all the pieces you need will fall into place. As a spider's web is to receive, your job is but to make the beginnings towards building. And that gave me calm. So I'm like, it's okay. I don't know how to do all this stuff. The right people are going to come at the right times, and it just starts happening. So I think that's what's going to happen here. We just have to say, look, these are our skill sets. Let's find each other. Let's talk to each other, and let's help each other. And that's my talk.
Well, it already has.